Bordetella Pertussis by Kerri Penberthy. The basics. Bordetella pertussis, also known as whooping cough, is a gram-negative bacterial infection causing a patient to have a terrible cough that lasts anywhere between 10 to 21 days. The most dangerous cases are those of infants, as they typically do not receive their first vaccine for the infection until the age of 6 weeks. Symptoms often appear very similar to that of a common cold, but as the infection persists, it worsens, leaving a patient with a horrible cough to the point they have trouble breathing, often coughing so hard that they end up vomiting as well. So what happens? Bordetella pertussis starts out very similar to that of the common cold. The CDC says that symptoms are typically mild and often go undiagnosed. These cold-like symptoms usually last 1 to 2 weeks. The mild symptoms are a runny nose, a cough, a mild low-grade fever, and apnea, which is a pause in the breathing pattern. Apnea only occurs in babies. After the 1 to 2 week symptoms progress and become more intense, the cough will become very rapid and go on for a long period of time. During these coughing spells, the lungs rid of all of the air, and as the person begins to gasp for air, it makes a whooping noise, which is why Bordetella pertussis is often called whooping cough. When not coughing, you feel fairly normal, but the coughing can be violent. These harsh symptoms last another 1 to 2 weeks. Recovery happens very slowly as the cough slows down and becomes less severe over time. This process can take up to 10 weeks. People who have recovered from whooping cough can get flare-ups for months if they get any other respiratory infections. What are the statistics? A report from the United States noted that between 1940 and 1944, whooping cough accounted for more than twice as many childhood deaths as the combined total for measles, scarlet fever, diphtheria, polio, and meningococcal infections. Currently, Bordetella pertussis causes 600,000 deaths per year, and there are 50 million positive cases diagnosed each year. 95% of these cases come from developing countries. Bordetella pertussis was highest in Africa, as they did not have immunization until 2000. Vaccinations. Although currently Americans have a great vaccine for this infection, it is still something that they deal with actively. As parents are more often choosing to not vaccinate their children, these infections are becoming more and more prevalent. Even if a child has received a few of the 5 Bordetella pertussis vaccines, they are still very susceptible to getting the infection. How effective is the vaccine? This organism has a 90% infection rate to those that are exposed and unvaccinated. Bordetella pertussis has a high failure rate for those that have been vaccinated. In a recent study, a group of 5,867 people were vaccinated and analyzed on the effectiveness of the vaccine over time. The results showed that in the first year, it was 84% effective. From year 1 to 3, it became 62% effective, and from year 4 to 7, it was only 41% effective. Pertussis is a disease that peaks every 3 to 5 years, and even with a vaccine, is considered an endemic worldwide. Because the vaccine is acellular, it is not as effective as it could be. How do you get it? This bacterium is transmitted through aerosol droplets that are expelled from the infected person's respiratory tract through severe coughing. The infected bacteria pass directly to the susceptible host, who then inhale the bacteria. The optimal environment for this disease is a human host. Unlike other Bordetella strains, Bordetella pertussis can only live in a human host. The bacteria lives best in warmer conditions and lives in the nose, throat, and mouth. Changes in the environment, such as temperature, influence Bordetella pertussis and how it is expressed in the host. Once the bacteria enters the body's temperature heats the bacteria. This rise in temperature influences the BVGS and BVGA genes. This gene regulation is controlled by temperature, and these, in turn, regulate the expression of the Bordetella pertussis virulence factors. This process disturbs the mechanisms and make it so the body cannot fight the infection. Who is most susceptible? The people who are most susceptible to get this infection are infants. That is why pregnant women are highly encouraged to get the booster during the 3rd trimester of their pregnancy. Until the infants have received their complete set of vaccines, they are highly susceptible. The people who are at the highest risk are young infants, especially those born prematurely, and patients with underlying cardiac, pulmonary, neuromuscular, and neurological disease. There has been a rise in number of cases in adults as researchers have learned that the immunization is not effective after the age of 12, and adults are encouraged to get a booster. This disease is most commonly found in highly populated areas as it spreads from people in close proximity. How do you treat it? WebMD tells us that the disease can be treated with a prescription called erythromycin. This will kill the bacteria, making people not contagious anymore. This does not take away symptoms, and it is not recommended to take cough medicine as that does not help. How can we prevent this? Vaccines are the best way to prevent getting this disease, as well as keeping up with your boosters as adults, specifically pregnant women. By 2020, most every state requires that children receive their 5 rounds of vaccines. Those who have been in close contact with an infected person can receive a post-exposure prophylaxis. And lastly, keeping your distance from an infected person is also helpful as it is spread person to person. Thank you.